Good morning, everyone, and welcome to NJBIA Live from the State Capitol. I'm Vinny Civitello, Communications Manager for the New Jersey Business and Industry Association. With us today are our very own Vice President for Health and Legal Affairs, Mary Beaumont, and Vice President of Government Affairs, Frank Robinson. A few housekeeping matters before we get started. Today's webinar is being recorded and will be emailed to you tomorrow along with the PowerPoint for today's presentation, so be on the lookout for those. I'd also like to draw your attention to the Handouts and Questions tabs. In the Handouts tab, you can download the PowerPoint for today's presentation. I get a lot of questions asking how people can do that, so just open up your GoToWebinar panel, click on Handouts, and click on the PowerPoint file there. It'll download right to your computer. The Questions tab is where you can ask questions for our speakers. Mary and Frank would be happy to take all of your questions, so don't hesitate to write them in as they come to you. And I can't stress that enough. Write them in as they come to you, because today's presentation might be a little on the short side, and you might get blindsided by the time we hit the Q&A and then not get to ask the question you want. So now let's get things started. Mary?
Morning, everybody, and thank you all for being part of our webinar today. There's obviously been a lot going on in the legislature in New Jersey, and then there's also some things still going on at the federal level, so we thought we'd take a omnibus approach this morning and talk about anything and everything healthcare related. And then, of course, we anticipate and are interested in the questions that you may have going forward. We'll start with our first slide, which I'm having trouble moving. So Vinny, give me a quickie how to do this.
Click right on the screen.
Okay, thanks.
And go ahead and do it again.
There we go. Thank you so much. Technical difficulties. So the first topic of discussion, which of course is basically sucked all the air out of the room over the last 10 years, if in case you were living in Alaska, is the out-of-network healthcare reform, which has passed both houses of the legislature as of April 12th and is currently on the governor's desk. This legislation is something that many stakeholders have been working on, as I mentioned, for the last 10 years, and it did get a good boost this past year with the fact that Speaker Coughlin, who's been the sponsor of the assembly version of the legislation, was able to reinvigorate the discussion, and we're very we've been part of that stakeholder group for quite a long time, and we understand that there was a lot of issues with respect to where the bill would end up. But at the end of the day, the legislation protects consumers from the unexpected, non-negotiable medical bills, and basically it applies when somebody is has to use or is uses an out-of-network healthcare provider either inadvertently because they've either gone through all their hoops and made sure that the providers will be in network, but then are inadvertently touched by an out-of-network provider, perhaps during an operation or at some point along their care path, or in an emergency situation when they're taken to a healthcare facility that's outside the network of their healthcare plan. The final amendments that were agreed to in April were at the behest or request of many of the hospital facilities that were part of the stakeholder group, and they eventually were supportive of the legislation, so we were very grateful for that, and that basically tipped the scales in favor of passage of the legislation out of the legislature. So, and those final amendments condense the time frame that the health insurance carriers have to pay with respect to out-of-network claims to the healthcare providers and the facilities. They also require that the health carrier's final payment for an out-of-network service is has to be the same as the carrier's final offer in arbitration. It removed certain provisions requiring the arbitrator to consider certain factors in making a determination. So there's a lot more flexibility for the arbitrator to consider the factors that the arbitrator themselves considers relevant. And it requires the insurance carriers to provide information to the Department of Banking and Insurance regarding the number of claims that where the carrier may have denied or downcoded the actual service or the coding for the particular service provided. And then it also, at the end, also requires that the governor and the legislature, that the Department of Banking and Insurance provide a report to the governor and the legislature, providing information about how the legislation is being implemented and working. So moving on to the healthcare tax legislation, which we were grateful to Senator Vitale and Assemblyman McKeon for setting up these particular bills. There were two bills. One would continue the individual mandate that is being eliminated under the Affordable Care Act, and that would go into effect under the federal law at the end of this year, at the end of 2018. The New Jersey legislation continues that individual mandate, which basically says if you're not covered by health insurance, you pay a penalty. And that penalty money in New Jersey will now be used to fund a reinsurance program, and that reinsurance program is available to reimburse health insurance carriers that might experience higher than average or losses that exceed a certain threshold from coverage in the individual health insurance market. And these are the two commercial markets that cover individuals in New Jersey and small employers, which are defined as 2 to 50 employees in New Jersey. This legislation originally did have a healthcare tax in it. It basically was an assessment on all health carriers' covered lives, and that included third-party administrators or TPAs. And so at the request of many stakeholders, including NJBIA, and our interactions with the sponsors of the legislation, that particular provision was eliminated, and now instead, starting in fiscal year 2020, there will be an appropriation from the general fund so that that particular, if there is a need for an assessment, the monies will come from the general fund, so it's basically spread out amongst the entire state, all taxpayers, as opposed to focusing on the two commercial markets, health insurance markets, that many of our members purchase coverage through the small employer market or the individual market. And the way the bill had been originally written, it would have caused premiums in the small employer market to increase. So we were grateful that that change was made. So basically, even though this slide is entitled Healthcare Tax, the healthcare tax has been eliminated. So thank you. Moving on to the medicinal marijuana program, Governor Murphy had issued Executive Order 6, where he charged the Department of Health to review the current provisions of the medicinal marijuana program, and he asked the new commissioner and his deputies and assistant commissioners to look through that program and come up with recommendations for better access for people in New Jersey who suffer from medical conditions where it's been proven or decided that medicinal marijuana would be helpful to them. So in doing so, the department issued the Executive Order 6 report, probably it was around March of this year, and in that process, the governor also appointed a new assistant commissioner in charge of the medicinal marijuana program, and immediately the recommendations included expanding the list of debilitating medical conditions that would be eligible for treatment by medicinal marijuana, and they include musculoskeletal disorders, migraines, anxiety, chronic pain of visceral origin, and Tourette's syndrome. So those conditions are immediately now available for coverage or for eligibility through the medicinal marijuana program. There's also some other action items that the department immediately put in place. They're allowing the commissioner to add medical conditions to the approved list in extraordinary circumstances without having to go through the regulatory process. As the slide indicates, the registration fee has been reduced. They will now permit satellite alternative treatment centers, or ATCs, so that the supply of medicinal marijuana is more available and accessible. They've also developed a mobile access portal for use by patients for registry and payment, and they've also eliminated the physician registry so that physicians who feel that they are interested and able to provide prescriptions for medicinal marijuana can be part of the program. The Executive Order 6 report also included other items, including regulatory items and statutory items, so those will take some time to implement, but NJBIA was honored to have Jeff Brown, who is the new Assistant Commissioner for the Medicinal Marijuana Program, at our Healthcare Policy Committee meeting in April. And if you were lucky enough to have attended, he gave an excellent presentation, or if you were able to listen through our remote access capabilities, and talked about the fact that everything that is included in that report in terms of regulatory items is currently underway at the department. They're working very diligently to be able to expand this particular program. There's also a number of statutory items that were listed in the report, including allowing edibles for all patients, allowing the patients to register at more than one alternative treatment center, allowing the use of marijuana as a first-line treatment, permitting an unlimited supply of medicinal marijuana for hospice patients, increasing the maximum monthly product limit, and also removing the nonprofit requirement for the alternative treatment centers. And those provisions are already incorporated in a number of bills that have been introduced by Assemblyman Conaway, Assemblyman Greenwald, Senator Sweeney. We understand that there are quite a few pieces of legislation. One of the other items that was also discussed at the Health Policy Committee meeting was the fact that the purchase of medicinal marijuana is subject to sales tax. So there is legislation, I believe it's Senator Turner, has legislation pending to remove that sales tax designation for medicinal marijuana, because it's just, again, many vulnerable people are trying to access medicinal marijuana, and it just presents an additional burden to them, or barrier. Moving to our next slide, we're talking about the opioid crisis in New Jersey. There are many things happening at the state level, again, to address the opioid crisis. We'll note that fatalities in 2016 exceeded 2,000, and it's my understanding that that number will probably increase for 2017. That data is not yet available, but in the budget hearings and in the Department of Health's budget, there is $100 million designated in funding for the prevention, treatment, and recovery for people suffering from opioid addiction. The Commissioner of Health testified at his budget hearings that the governor is also investing $56 million in prevention. I'm sorry, somebody noted here on the slide that it's $57 million. Prevention and treatment programs. They are looking for increased access to the community-based outpatient programs. And then on the law enforcement side, the Attorney General announced in February the creation of a new office to fight the opioid addiction crisis that would be located in the Attorney General's office, but would also work in partnership with other state departments, and it's entitled New Jersey Cares, or the Coordinator of Addiction Response and Enforcement Strategies. And they're going to be responsible for overseeing addiction fighting efforts across the Department of Law and Public Safety, creating partnerships with other agencies and groups that are committed to identifying and implementing solutions to the opioid crisis and drug addiction. The new acting director of that particular office is Sharon Joyce, who's been with the Attorney General's office for over 30 years and has been instrumental in drafting and implementing regulations surrounding the prescription, the physician prescription monitoring program. So she's a very well-seasoned person and very capable of handling this particular oversight function within the Attorney General's office. Another hot topic in healthcare, which goes back to last summer, was the enactment of the telehealth legislation in New Jersey. The telehealth legislation sets up parameters for increased electronic communication and increased access for patients and providers, so that in-person office visits, which can be difficult to schedule, sometimes it takes a while, and some things are easily treated through telehealth provisions. This can continue to take place, and it sets up best practices. There have been a number of efforts over the last few months under this governor in terms of developing the strategic planning for the implementation of the telehealth legislation. Recently, the New Jersey Telehealth Strategic Planning Roundtable met and went through a number of exercises in terms, and this group of stakeholders has been meeting for quite a few years in anticipation of the legislation being passed, and worked very diligently to get the legislation passed, and is now working with the Department of Health and the other departments with the ultimate goal to increase access for all people, patients in New Jersey, so that if people need assistance with their care, they can get it. A lot of folks live in remote areas of our state, and even though you wouldn't necessarily think of New Jersey as a rural state, we do have very rural areas with few healthcare providers in those particular areas, not as many as, say, in the urban areas or in the areas that are closer to New York and Pennsylvania. So this is a good way to expand access and also reduce costs overall, because first of all, the patient themselves isn't taking off time from work. The employer is not losing, the services of their employee for a day or half a day. The employee or the consumer or the patient is able to get care quickly, and also be able to have follow-up care. So there's an opportunity for reducing costs and an increased opportunity for access to services. This also goes hand in hand with the fact that all consumers, employers, employees, patients, everybody is becoming much more savvy in terms of their decision-making over their own health care. And this gives them another opportunity. We've also heard the stories about millennials who are excited about new apps, and apps on your cell phone are a great way to be able to access care, find out information. This is all part of telehealth, telemedicine, and it's also a way, if you as a consumer or a patient have the ability to get a better understanding of how much your care really costs, are there ways where you can be efficient? This is a great way to do it. So we have very high hopes for how telehealth will be expanded and implemented within our state. Our next slide highlights what we're calling pharmaceutical regulations. These are regulations that were proposed late last year, and they basically impacted our life sciences companies as well as our research universities, our major research, medical and pharmaceutical research hubs within the state, and then also many of our physicians here in New Jersey. The proposed regulations would have severely limited the ability of physicians and researchers to accept gifts or funding from pharmaceutical companies. And the way that the regulations were originally drafted were very restrictive, and there was a public hearing that was held by the Attorney General's office where I believe the testimony went on practically over a whole day. And NJBIA also provided written comments to that rule proposal, basically explaining that the economic impact to our life sciences and our research universities would be pretty critical, and it would basically cause researchers and research funding to other states where they were a little bit more, these types of processes were there was oversight of these processes, the funding and from the entities to the healthcare providers, but that if New Jersey's regulations became more restrictive than especially our surrounding states, then that would impact our state's ability to continue to be competitive in the overall pharmaceutical industry, research industry. It would cause a lot of difficulties for the New Jersey research centers to attract good and committed research personnel. So the Attorney General's office did consider and loosen some of the restrictions in the final rule adoption. However, they still cut a little too close, and so that there are continued efforts and conversations with the current governor's office to see if there's an ability to either repeal the regulations altogether or to expand them so that they are not as restrictive, and so that they give the companies that are based here in New Jersey and are highly regarded research universities and medical centers the ability to continue to attract the talent that they need to attract, and to continue to keep New Jersey competitive with the other states that may become more attractive if these regulations are allowed to continue. And our final slide talks about issues occurring at the federal level. The federal government proposed a new regulation earlier in the year regarding the expansion of what's called association health plans, and that would basically allow employers to join together to purchase health insurance in a little bit more of an expanded way than is currently allowed under federal rules, and is somewhat at odds with current New Jersey laws and regulations. And one of the concerns, the New Jersey Department of Banking and Insurance has submitted comments in response to this rule proposal, basically saying that the regulation of insurance should stay with the states. They best know their population, they best know the way that their markets operate, and have the expertise to understand what will and will not be helpful in terms of changing the rules. And this also gives NJBIA the opportunity to talk about the fact that in order to provide or to help our small employer or actually any of our members be able to access health care coverage that could be less expensive than purchasing in the commercial market, NJBIA partnered with the Association Master Trust and is now offering a health benefits solution or plan. Our NJBIA members are able to purchase health benefits through our membership in the Association Master Trust. And the Association Master Trust is a MIWA, which is a multiple employer welfare arrangement. And under New Jersey law, MIWAs that operate in New Jersey are required to meet certain requirements. That was another proposal, I believe it was in the late 1990s, early 2000s, because of the fact that New Jersey had initiated health insurance reforms in the early 1990s. The concern was that the sense was that they didn't necessarily want MIWAs to operate in a fashion that would undercut or undermine the types of benefits that were required to be provided in the commercial market. So the MIWAs in New Jersey are required to offer substantially similar benefits that are available in the small employer program or through the small employer health benefits program, but there is a little bit more flexibility, and those health plans through the MIWA are a little less expensive than purchasing in the commercial market. So although NJBIA is recognizes that our small employers need choice, we also want to be careful, because if for some reason association health plans are allowed to operate in New Jersey, they won't necessarily be regulated by the state, and their coverage would probably be very different from what our employers and current consumers are currently expect to be, types of benefits that are expected to be covered. So there would cause some issues and confusion in the sense that people might purchase something that they think they're getting coverage for, but they may end up not getting coverage for. So there's caution moving forward, just so that people don't feel like the rug's being pulled out from under them. So, and with that, I think we're done. I'm done. So anyhow, and I don't know if Frank has any questions, or Vinny, if any of our folks on the webinar have any questions.
Absolutely. Thank you so much. We do have a few questions. I'm going to stall a couple minutes here, give people a chance to type in more. So while I'm doing that, let me point out the Handouts tab in your GoToWebinar panel. I get tons of questions. How do I download the PowerPoint slides for today's presentation? No matter how many times I tell you guys how to do it, the question always pops up. So you just pull out your GoToWebinar panel, hit Handouts right there, and the thing is right there, LFT SC 050918. We don't label these things cryptically. Live from the state capitol, May 9th, 2018. They'll also be emailed to you tomorrow along with the video recording of today's presentation, so be on the lookout for those. And again, the questions tab is right underneath that. You've got two experts here. I know Frank was uncharacteristically silent today during the presentation, but he's right here and he's ready to answer questions. So you've got two experts, so feel free to take advantage of them. Our first question comes from Joel, who would like to know, is NJBIA working on getting new carriers in the marketplace given the loss of Aetna this year and others in the past for the small group market?
That's a great question, Joel. There's always a sense that the more carriers that are in the marketplace, the more competition will cause prices or health premiums to be more competitive. And it's our understanding that there is a movement to attract new carriers to the market. But right at this point in time, NJBIA hasn't necessarily taken that cause up, but that's a great suggestion, and we'd like to look into that.
One of the things that Mary and everyone works on here at BIA is looking to make business more affordable and make the state of New Jersey more affordable in the state of New Jersey. And that is a good suggestion. Very complicated, but we definitely will look into it. And I mean, our first foray into all of this was to get involved with the MIWA, which we've had hundreds of our members sign up just in the last couple of months on that, and they're finding it to be very beneficial to their companies. I just had breakfast with someone this morning who tells me that they're saving about $500 a month. It's a small businessman who has a family plan and one employee, and he's saving now about $500 a month on his premiums. So we're always looking for something more affordable, and as Mary said, we'll take a look and maybe getting a little bit more active in that.
Our next one comes from David, who asks, if a procedure is done and some providers end up being out of network, how does the out-of-network reform bill limit out-of-network balance billing? How does this work with many ACA policies that have no out-of-network benefits?
Again, it depends on how the person, or is your health insurance through the commercial market? If that's the case, then you you are able to take advantage of the fact that New Jersey regulations specifically say that the patient cannot be balance billed. So the patient themselves shouldn't, and that we're talking about emergency or inadvertent issues. We're not talking about voluntary decisions to go out of network. And that is an issue because health insurance and healthcare benefits are becoming so expensive. People are becoming very creative in the way that they deal with that. Some health plans, employers are sometimes faced with the choice of purchasing a plan that has out-of-network benefits that's costly, or purchasing a plan that does not provide out-of-network benefits that is more affordable. So unfortunately, that's where employers are these days. So they're looking to minimize these costs because the costs continue to increase. And sometimes you're hit with double-digit increases. And again, the health carriers in New Jersey are going to be filing their rates this summer, and it's expected that the New Jersey rates will remain under 10%. But again, New Jersey requires a lot of benefits to be covered under commercial health plans. So there's a lot that goes into the discussion about, healthcare costs and why are they so expensive. So every health insurance carrier is required to have an appeals process. So if there is a decision or a determination in terms of, whether or not a benefit is covered, those processes are in place so that consumers can access them. The other part of the out-of-network legislation is that the arbitration process basically it basically prohibits balance billing. It codifies or reinforces the current state regulations. And so going forward, there should be less impact to consumers in terms of balance billing for inadvertent or emergency out-of-network episodes.
Okay. Next question comes from Joel. Does NJBIA have a committee of members that meet on a regular basis to discuss health insurance in New Jersey?
Yes, we have the Health Policy Committee, Health Affairs Policy Committee that you're able to join just by going on our website. And if you, is it under advocacy, Frank?
Under advocacy
Thank you.
Yes, it's the top of our website in the advocacy tab. There's a drop down where you can get lots of information about our various policy committees, and you can sign up. You have to be a member of the association, but Mary's Health Committee meets on a quarterly basis, usually has some very exciting speakers, meets here at our headquarters on West Lafayette Street in Trenton. We usually serve a light breakfast. Chairwoman of that committee is Miss Charlene Davis, who's a senior vice president at St. Barnabas, and always have a very interesting program. We've had, Mary mentioned earlier, Commissioner of Health in, lots of different legislators who are involved in the whole process. So it's a great committee to join, and we hope that Joel is a member of the association and that you sign up.
And I'd also like to add that as a member of the Health Affairs Policy Committee, we also send out periodic issue reports when there's legislation moving through the legislature that would impact health insurance premiums. Those bills are included in an issue report. We list the bills, we mention when they're going to be heard in committee, we ask for your input, and anybody who is an NJBIA member or a member of the Health Affairs Policy Committee, at any given time, if you have questions, please feel free to send them in.
One more from Joel. He'd like to know, would NJBIA be able to propose members to the committee that discusses small group insurance matters at the New Jersey Department of Insurance?
Well, NJBIA actually has a seat on that on the Small Employer Health Benefits Program, and actually I'm the NJBIA designee. So if there are issues or questions that you would want, and actually if you go on the Department of Banking and Insurance's website, that information is available. All of the meeting minutes are posted. Most of the time we're discussing regulatory proposals. You know, if Joel, if you'd like that information, you can send me an email and I can send you the link to the department's website and we can have a further conversation.
Here's one from Neil. Can you please go over which requirements are bypassed under association health plans, and can member organizations of the plan be in different states, while administration of plan is from one main state only?
It's my understanding that the members of the plan, of an association health plan, can be located in other states. And I apologize, I do have the federal rule proposal, and I can digest that and send that out to you separately, Neil.
Great. A similar question, I don't know if it covers the same stuff, but Valerie asks, does NJBIA's Association Master Trust include small companies that are national in nature? We have contractors that travel a lot and most commercial markets won't cover out of New Jersey doctors.
It's my understanding that if the employer is located here, that they could be eligible, but that's a question for the Association Master Trust folks. If you want to follow up separately, I can forward that question to them and get back to you.
There's another one from David. Have there been any association health plans who have announced availability in New Jersey other than AMT?
I am not aware of any, and because the federal rule has not yet been finally adopted, the comment period ended, I believe, in March or April. So the Federal Department of Labor is going through the comments and hasn't issued a final rule. So I don't believe so.
Connor has a question for Frank. Are you expecting a budget compromise in place by the June 30th deadline?
Connor, let me get out my handkerchief so I can dust off my crystal ball. As most of our listeners know, over the course of modern time, the state government has only been shut down twice because it missed the June 30th deadline. First time was Governor Corzine's first budget, when he got into a little bit of a disagreement with the democratically controlled legislature over whether or not we should have raised the sales tax back at that point in time, and the state was closed down for approximately a week. Second time was last summer, when there was a disagreement between the General Assembly and the Senate and the governor over legislation that would have, ironically, we're talking about healthcare today, taken money out of Horizon Blue Cross Blue Shield to the tune of about $140 million. And so those are the only two times in modern history. Everyone's reading in the papers about how the Democrats are fighting among themselves, whether it's the executive branch versus the legislature, or the Senate and Assembly can't agree on certain things. It's still relatively early in that process in Trenton time, even though we're only about 7 weeks away from the deadline. That's 100 years in Trenton time. And I personally, my own prediction is that they'll get it done on time, that the governor and the Senate president and the speaker and Democrats and hopefully some Republicans all agree on a spending plan. There's always room for compromise. I know for a fact, I came from a meeting this morning where I learned that there are increased conversations between the governor's office and the Senate. And so I am hopeful, and my prediction is we will have a budget on time.
Very cool. Another one from Neil. He asks, AmeriHealth left Medicare plans in New Jersey, and now we hear about Aetna as well. What efforts are underway for Medicare customers?
For more health carriers to be in that market? I don't understand the question. Yeah.
So Neil, if you want to clarify that one, just type it in and we'll ask another question while you're doing that. Otherwise, we can just move on. So Wanda asks, the out-of-network bill is on the governor's desk. Do you have an idea when it will be signed?
Well, the legislation passed both houses as of April 12th. Under the Constitution, the governor has 45 days to sign or let the bill become law, or veto it or conditionally veto it. So, and that 45 days runs out on or around May 29th of this year. So, and I know that the Memorial Day holiday falls in there, so there may be an extra day or two added on to that.
Bruce asks, will the out-of-network bill actually save money?
Well, it will save money in the sense that out-of-network costs that are paid by particularly public employee health benefits plans and commercial plans will decrease because of the fact that this legislation is basically a cost containment measure that will keep out-of-network costs from continuing to increase, and it puts some parameters around how much, or how it puts parameters around the balance billing piece. So yes, how much it will save at the end of the day, the fiscal note for the legislation talks about the fact that the number's indeterminate because the impact will, you could see the impact going forward on public employee plans and some municipal plans, and it eventually will help all taxpayers in New Jersey in the sense that certain costs that were going for out of certain costs that were going towards out-of-network costs will not rise as quickly or as highly as they may have in the past.
Well, that looks like about all the questions we have, so it's as good a time as any to bring things to a close. Don't forget, all of you will be receiving a recording of today's webinar and the PowerPoint slides via email. Lastly, when you close out of the webinar, a survey will come up on your screen that we hope you'll fill out so we can understand how to best provide you important information in a webinar format. Our next webinar, Unlocking the Hidden Value, of the real estate underneath your business facility, will take place Wednesday, May 16th. So by all means, feel free to register for that one right on our website at njbia.org. If you're more into our policy-related ones, our next Live from the State Capitol edition will take place July 11th and will feature Mike Wallace and Andrew Music. So look forward to that. So until next time, for Mary Beaumont and Frank Robinson, this is Vinny Civitello thanking you for being with us this morning and wishing you a good day.